Hello and good afternoon, Mamlaka. This is Midweek Vibes with me, Reverend Maggie Moore here, and I'm so glad to welcome you to the show. And today we are so blessed to have with us a medical professional to discuss a topic that is in your hearts. It's in your sitting rooms, it's in your offices, in your boardrooms, it's everywhere. It's on your radio, it's on your TV, the COVID vaccine. So today we'll be looking at that vaccine. We are going to be looking at all the issues surrounding it, especially now that we did the first jab. How about the second jab? What are the issues around it? How can we mix the vaccine and stuff like that? So don't go anywhere. Invite your friends and stay tuned as I introduce to you our guest. Caro, Dr. Caro, yes. Please introduce yourself fully to us.
Okay. Thank you, Pastor Maggie, for the invite and the chat. My name is Dr. Caroline Gulavi. I'm an internal medicine physician currently practicing, and I am excited to delve into this wonderful topic, COVID-19 vaccination. What next?
Mm-hmm.
Yeah.
Fantastic. Karibu sana. We are so delighted to have you. And I need to tell you guys that Caro is one of us. So you are listening to your own family, and it's amazing that she's going to help us explore the issues around it. But let me just welcome guys from as far as Michigan, Lansing, Michigan. We want to welcome guys from Kisumu, from all the towns in this country. And I want to say a good thank you to the team that was in Kisumu last week that tuned in and gave us amazing feedback. So your questions, your feedback is what we want. Do let us know what you think, what you want to know more, understand better. So, Dr. Caro Gulavi,
yes.
I think I should call you, I'm easy with calling you Caro.
Caro is
Caro
fine.
is good?
Yes.
All right, Caro.
Perfect.
So let's begin by opening this topic and say, up to date, what are the issues going on now? So, for example, we have received a number of vaccines or vaccinations.
Yeah.
Vaccines. Then we have done some vaccinations. Give us a good overview of how it's happening there.
Okay. So, as a country, Kenya, we've received, early first week of March, we received 1 million doses of the AstraZeneca COVID-19 vaccine. Otherwise called Covishield, produced by COVAX. So, just AstraZeneca vaccine. So, up to date, we have given out or rolled out around 937,000 vaccinations of the first dose. So we have waited for the second dose, and we have some in the country, and there are around 130-something thousand vaccinations. So,
okay,
yes.
I just wondered, did you say we did the first jab?
Yes.
Close to over 900,000.
Yeah.
And now for the second, are we talking about the second jab?
Yes.
So we have like 100 and something?
We have 100-something thousand vaccines. So that leaves, I know that's an question, 800,000 people who've already received the first jab who may not necessarily get the AstraZeneca vaccine. So
what will they get?
So what will they get? That's a good question. So as a country, Kenya, we have, or they're outsourcing another vaccine called the Johnson & Johnson by the company called Janssen. And they're outsourcing the rest of the vaccines to at least complete the second jab for the people who've already gotten the first vaccination. So currently, where do we stand as a country? If you're able to get the first 100,000 doses of the vaccine, which I understand that has been kept aside for the healthcare professionals, understandably so, and probably the generation, the old, the elderly, then definitely go ahead and get that. For the people who may not get the second AstraZeneca vaccine, I understand the Johnson & Johnson is coming in August, so will we wait until August? What are our options there? Yes.
Wow, that's a good education there for us.
Yeah.
But my mind wonders two things. So the first vaccine came in March. Then the information was wait for 2 months. There was trouble with the Astra vaccine. Then there was trouble with the Johnson & Johnson vaccine, which will help us understand that trouble a little better. But there's a delay.
Yeah.
What is the implication of that delay? So two questions,
Yes.
therefore.
Yeah.
The problem with those two vaccines, and yet we are still taking them, or they're still varied here. And then the second piece of that question is the delay. How does the delay affect those who took it in terms of getting infected?
Okay. So let me start by a quote by the CDC, which was brilliant. So the best COVID-19 vaccine is what you already have. Okay? So let's start there. So we have, as a country, AstraZeneca that came for us. So what are the issues surrounding AstraZeneca? So one of the main issues, addressing your first question, was the issue of getting clots, and basically clots that will come in the legs, what you call the DVTs, and also clots in the lungs, okay? So studies were done and showed, are these clots more in the population that have gotten the vaccinations vis-a-vis those that haven't? And they were slightly more, okay? But then we looked at, does COVID itself, the virus, cause clots? Yes, it does. And it actually causes more clots than the vaccine. So it's a risk and benefit weighing ratio. So going back to the best vaccine is what you already have. So the AstraZeneca has shown promising results to at least 60% protection against severe disease. That's a COVID vaccine. And so when you put it at the risk of getting clots vis-a-vis getting COVID, then definitely you'd go for the vaccine.
That means the clots are treatable?
The clots are treatable.
And they're not fatal?
There have been 3 cases of fatal clots where that led to death because of obstruction of blood flow in the lung vessels. Okay, so out of the many thousands that received the vaccine, they found a very small population that got fatal clots. But majority of the clots, if gotten early, those are treatable. Okay, then comes the Johnson & Johnson vaccine that had been halted in the United States, and there was the hullabaloo of why are we getting it if other countries are halting it. And the main side effect with the Johnson & Johnson was also clots, but specifically clots that will develop in the brain. Okay.
Yeah, that's alarming.
Yes.
Yeah.
So the brain have very tiny blood vessels, the veins that we have, but they're in the brain, and they just take away blood from the brain to the rest of the body. And so they develop clots inside there. And so patients will present after getting the vaccine with fainting episodes, or you just collapse because now there's no blood flow.
Right.
But then it was halted as pending investigations around for 11 to 14 days. That's in the United States. And they looked at this population. It was mainly of young females who have no other illnesses and gotten the vaccine and developed these clots. But then as early as last week, they actually resumed the Johnson & Johnson because
they
did. Because
why?
After several studies, because what happens in vaccinations is you look at the whole population that have received the vaccine and those that have reported side effects like clots. Is it negligible? Is it something worth stopping? Or is there, like going back to my risk versus benefit ratio? And they said, you know what, for countries who only have the J&J vaccine, that's the Johnson & Johnson, please go ahead and use it, but they put a caveat. And the caveat was, for young females who are less than 50 years of age, then those should consider alternative vaccines because that was the highest population at risk of getting these clots in the brain. So comes to our question.
Yeah.
So now that we're getting it, what do we do as a country?
Yeah. Well, that question is still begging an answer?
Yes.
Or do you want to attempt it?
Let me. We definitely have to get a vaccination. And going forward, that is the role, or that is the only way that has been shown that we'll actually get rid of COVID. It's just vaccination and getting the immunity that we need from the vaccinations. So going forward as a medical practitioners and the studies that are out there, yes, there is that risk for the J&J vaccine, just as the same there was the AstraZeneca risk vaccine, but it is the only thing we've got, so we've got to take it.
Wow, that's a worrisome response. And the reason is, for us as a church, for example, even though the percentage is so small, those are souls, those are lives. So we see every person as a major component in terms of the population that will be affected negatively. So that remains a concern for us, and we are looking forward to a vaccine. So we want to find out, is there a vaccine that you can wait for that doesn't have this kind of side effects? That's one aspect of that question. Let me deal with that one first.
Okay. So borrowing a lot from the United States, who have alternative vaccines, and these alternative vaccines are the Pfizer and the Moderna vaccines that have been used, and those are actually the ones that are in use in the United States. AstraZeneca is not. Johnson & Johnson is neither here nor there. So Pfizer and Moderna have actually been shown with the data that we have as the safest vaccines so far. You know, more studies are being done around these vaccines, but then they do not have the side effects that have been reported of clotting. So Pfizer and Moderna, do we wait for them? The best vaccine is what we already have as of now. Going back to that.
What we have is what is the best.
What we have is what is the best.
Because that's what we have.
Because that is what we have.
Now, coming back to what we have is the best.
Yes.
This small category of people who seem to react severely in that age group that you have defined of 50 and among females, is there something that can be done to either mitigate completely or moderate the effects?
Okay. So that's an interesting question, because that's the sphere that we are in right now in the medical field, where we're seeing patients taking other medication, you know, like I'll have the vaccine and take aspirin, you know, so that I prevent the clot. So no, that is not supposed to happen, because the mechanism of actually what's happening, what's causing the clots, is that your platelets, those are cells that make your blood clot, they actually reduce further. So by taking medication that reduce them further, then you're predisposing yourself not only to clots, but also to bleeding. So what can we do?
I think, Caro,
yes.
Just say that again slowly.
Okay.
Yes, just slowly, carefully say that.
Yeah.
Because you, as a medical practitioner, you know that we are very good at self-medication.
Yeah.
We like to go across the counter, buy something that my friend took another day for a different disease. That is common amongst our population. We know that. So speak to us. Okay. Speak to our people. Yeah.
Yes. So with the vaccine or post the vaccine administration, you should not take any over-the-counter medicines that will alter your blood, what we call viscosity or thickness. And such medications include aspirin, that we're seeing a lot of people who are taking over-the-counter because of the risk of clots, or other blood thinners like rivaroxaban and others. So the mechanism of these clots, what we are forming in the body, is actually the cells that form clots in your body, they actually decreased, okay? So by taking blood thinners, you're actually now predisposing yourself to bleed. And you can have very severe bleeding, especially bleeding in the brain or bleeding elsewhere, okay? So once you get a vaccine and you find that, you know, you're going over and above the common side effects that we have been told, you know, the pain around the site, the fevers, the weakness, the nausea that comes. Now, if you find that now you're having leg swelling, difficulty in breathing post the vaccine, please go to your nearest facility and that you'll be checked for clots. Okay, so no over-the-counter medication. The only over-the-counter that we can tell you to get post-vaccine is paracetamol. And that just helps with the fever, the weakness, the muscle aches that you can get. Okay? Yes, so no blood thinners or anything of the sort.
Fantastic, thank you for that answer. But I have a secondary question. Yes. At the vaccination sites, for example, how equipped are our nurses or those dispensing the vaccine to treat those adverse reactions?
Okay, so our team actually had went for a training. It was a 2-day training, very vigorous about what to expect. And after a vaccination, you're told, you know what, stay somewhere for 15 minutes, let's observe you. Because especially for the fainting episodes, that were shown to happen 15 minutes after. Okay? So then they're supposed to observe you, and the nurses observe you. But as a country, we realized that there's some side effects that are being reported way over the 15 minutes that you're told to wait, and this may occur in days. And so as a country, we came up with a drug adverse effect form. You know, it is a form that wherever you got the vaccine from, they should alert you that in case of any overt side effect, then you should report it to us. Okay, that's the site where you got it from. And so the nurses or the people who administered that vaccine should then fill that form. It is an online form, and that will be relayed to the ministry. And so our ministry actually should have, for the people who cared to write the adverse effect that they experienced, they actually have a database of what adverse effects were actually reported by the country, and that's going on for every country. Because you'll realize most of the data we are having, it's actually data from the West, you know, who report these side effects.
And
so
yes, indeed.
And so as a country, we want to see, is there something different, or are adverse effects as much or as like the West? And so there is that information that should be relayed to the ministry.
I like that. I like that very much. I would like to come back to that a little later before we wind up this. But talking about the adverse reactions, I've heard, and I need you to correct me if I'm wrong on this one, that especially the Johnson & Johnson, the reactions come way later, like 2 weeks after the jab. What's going on in the body for that kind of delayed effect? For example, by the time it is registering that the clot is in the brain, what's been going on? Did it start somewhere else in the body, or what was going on around there? Please help us understand that a little bit. Okay.
So there are 2 types of adverse events that we have. So there is the immediate, okay, and there is the delayed. And I'll bring it home to one of the delayed events that we see, and that will help us understand as to what's happening to the J&J. When a child is given the BCG vaccine, okay, so you won't see any wound as of you know, when they're given, but probably 4-6 weeks down the line, or even 2 weeks down the line, then something comes out and develops a wound. So now that is a delayed immune response that happens. Same with the vaccine, okay? So this vaccine has been taken to mimic the virus. So if I'm exposed to a virus, so the virus will come in, it enters the cell, it goes to something in the cell, and then, so all that is a process that takes days, okay? So it fuses with my body cell, okay? So then it goes to where it's supposed to act, say that's in the lungs, okay? And then now it shows itself. So the vaccine will be taken up. It's a foreign object. So first the skin realizes, this is a foreign object. So that's why you have some bit of redness, some bit of pain. And then it gets into your body, okay? So it has to get to all the cells in the body, and that takes a while. So some people will react very adversely. You know, it's like a virus or something that has gotten into your body, and this now the body starts reacting to it. And the reaction can be so severe such that it goes and targets these platelets. You remember the cells that I talked about? And so it starts killing those cells. That's the good cells, okay? But in essence, it's just doing its own work of getting the immunity. And so now the platelets then, they also react by clotting with the little they have and forms clot. So it's a very complex thing that happens in the body, and it takes a while. So just the delayed, and that's why you're told once you get the vaccine, the delayed effects may actually happen 2 weeks. And that's why they tell you that you're not fully vaccinated until 2 weeks after receiving your second vaccine. because it needs 2 weeks to act and to work and to penetrate all the cells, but also then 2 weeks to start showing its effects.
Oh, that's a very good explanation, which makes me want to ask a question. All those side effects, for example, there's nausea, there's vomiting, there's feeling sleepy, for example, things like that, and then weakness, tiredness, stuff like that. So does that mean that that's how the body is reacting to the vaccine?
Yes. Yes, it is.
So nothing has gone wrong yet?
Nothing has gone wrong. But then the questions that have been, what if someone had COVID, the virus, but it was asymptomatic, but then you received the vaccine? Then that's so people will have a greater response and greater side effects as opposed to someone who actually doesn't have the virus. And so that's why people will be very varied. One person will have the vaccine and work out very well, and someone will have the vaccine and be in bed for days on end. So it's about how strong is your immunity and how strong is the vaccine dealing with all these other cells, but also have you been exposed to the virus before? Vis-a-vis, do you have an asymptomatic form of the virus in your body?
Right. Yeah. Fantastic. Thank you so much. I think we're going to take a very short break. And when we come back, we'll tackle a point you have raised, which is very good. You talked about how strong is your body immunity. So we're going to talk about that when we come back. Okay. So guys, don't go away. We are on a short break. When we come back, we'll tackle that and more. Let me have your questions. We will tackle them. Dr. is right here to deal with that.
Nasema nitaweza kuikabili kila hali, kwani Kristo unipa nguvu. Na tena lasema wewe unawapa uwezo walio hafifu, na wanyonge unawapa nguvu. Lakini Bwana, sina nguvu, sina uwezo, niko hoi kwa uchungu. Nirudishie nguvu kama ulivyoahidi, nirudishie nguvu kama ulivyoahidi.
back, guys. It's me, Maggie Mo here on MIDWEEK Wipes today, and Dr. Caro Gulavi is our guest today. And we are learning a lot about the vaccine and how it's currently displaying itself in our populations. So Dr. Caro, yes. Karibu back.
Thank you.
We want to now look at how we can get really ready to face the adverse effects of this vaccine. Mm-hmm. And you talked about the need for a strong immunity to handle the vaccine well. So let's talk about that a little bit, mm-hmm. and help us understand as a citizen, as a woman or a man, mm-hmm. An adult, a child, mm-hmm. how can we be better prepared for the vaccine even as we wait?
Okay, so boosting your immunity in the sense of what you eat, mm-hmm. okay? So eating a balanced diet, mm-hmm. eating foods that are rich with vitamin C, mm-hmm. and D, mm-hmm. And exercising, mm-hmm. Control of other illnesses. Mm-hmm. And I'm happy that earlier on you were telling me how other conditions, mm-hmm. are being relegated, you mm-hmm. know, yeah. Our diabetes, mm-hmm. making sure that your sugars are in check, making sure that your high blood pressure is in check, mm-hmm. And other conditions that mm-hmm. one may mm-hmm. necessarily have. So just mm-hmm. basically boosting your immunity mm-hmm. to be ready mm-hmm. for the virus, mm-hmm. but also the mm-hmm. vaccine mm-hmm. for when it gets, and before the vaccine confers you mm-hmm. your protection, or mm-hmm. what you call your immunity mm-hmm. at that. Yes. Oh. Note, I haven't mentioned any medications.
I listened to that. I heard that. Yeah, I didn't mention any.
Yes.
Yeah.
Because then there's a lot of over-the-counter medications mm-hmm. people are taking to boost your immunity. Mm-hmm. Others even taking antibiotics that are not and should not be taken, mm-hmm. whether you have COVID or otherwise. Mm-hmm. Yeah. Because then what we're doing is that we're developing a lot of antibiotic resistance mm-hmm. that will come mm-hmm. way down the line that we'll see. Mm-hmm. So no medications really. Mm-hmm. Let us eat mm-hmm. normally, let mm-hmm. us eat a balanced diet, let us mm-hmm. be careful mm-hmm. about other conditions mm-hmm. that we may essentially have mm-hmm. and seek medical help for when and
nice.
That. Yeah.
Fantastic, that's good. I think we've had it. We stay healthy and we boost our immunity by just eating right. Yeah. And I think we generally know how to eat right. Yeah. Yes, but I think in a week's time we'll be talking about nutrition.
Perfect.
On this show. So guys, stay tuned. Yes. We will talk about that in a bit. Yeah? But for now, yes. I read an article. Mm-hmm. It was online mm-hmm. about an island, one of the many islands mm-hmm. on the Mediterranean coast. Mm-hmm. Is Seychelles. Yes. The article was saying that Seychelles is one of the most vaccinated population mm-hmm. in the world, mm-hmm. and yet they have a rise in COVID cases. So the question is, mm-hmm. Is there a problem there? What's the issue there? Mm-hmm. So high vaccination, mm-hmm. high rise of cases, I think it would be helpful to understand what's going on around there. Mm-hmm.
Yes, Seychelles is an interesting case study, mm-hmm. even for the medical field. Mm-hmm. So their population that has been vaccinated is actually more than 67%, mm-hmm. which is among the highest in the world. Mm-hmm. But then now we're seeing a rise in COVID. So what has happened? Mm-hmm. So of note mm-hmm. is that 60% of those who have COVID mm-hmm. actually received one dose mm-hmm. of mm-hmm. the COVID vaccine. Mm-hmm. Majority of the population got AstraZeneca vaccine and mm-hmm. got a Chinese vaccine that mm-hmm. I'm not aware of the name, mm-hmm. okay? But 37 of patients mm-hmm. who actually have the virus now got 2 doses. Remember, mm-hmm. full immunity is conferred after the second dose, okay? Right. So majority of the patients who we're seeing mm-hmm. with COVID cases is those who have not yet been vaccinated, uh-huh. but those who've only received 1 shot, which tells us then you need full vaccination mm-hmm. to confer immunity. Mm-hmm. The second hypothesis is the variant. Mm-hmm. Is it a different variant? Mm-hmm. And currently in the world, we're battling with the Indian variant. Mm-hmm. That is the latest variant currently. But also, is there another variant that hasn't been typed? Yes. So that's something that they're actually looking at in mm-hmm. Seychelles. Mm-hmm. So Indian variant, I know we'll talk about that. We're or rather, it's already here.
Right,
and we saw the havoc that it caused in India.
Yes.
a few weeks back. So does the vaccines that we already have and those that we're getting confer immunity against the Indian variant? So 60% of patients who've received AstraZeneca actually have at least 60% immunity towards the Indian variant, which is something as opposed to zero immunity.
Oh yes, indeed. Yeah.
So it's still a fresh space to see and see how we will do, but for sure we need the second dose in us to confer full immunity against any other variant, even as studies are being done. So in Seychelles, partly vaccinated, but also a new variant that could be causing the surge. Yes.
Wow. So that brings me to the next question.
Yeah.
So it takes me back to an earlier conversation before we took a break, that so we have two vaccines. The AstraZeneca vaccine, and then now we have the Johnson.
Yes.
And we had the delayed vaccination second vaccination because of the absence of the vaccine.
Yes.
So let's talk about the mixing. How will the body interact with the second vaccine if it's different from the first one given? Let's talk about that.
Okay. So someone had actually expected that we'll have a mix and match, what we call a mix and match vaccine. And some studies have been done where they mixed the AstraZeneca vaccine, because that's what was there available at first, and the Pfizer vaccine. This was in the United States because they have the Pfizer vaccine. And it has actually shown that it conferred better immunity than receiving 2 doses of the AstraZeneca, of the same vaccine. And so that is good news for us who, who were not sure what about the mixing and matching. Will it help or will it have side effects? So no, it's actually boosted. It shows boosted immunity. But to note that these were 2 different vaccines, that's the AstraZeneca and the Pfizer. We haven't had studies come out yet with AstraZeneca and J&J, that's a Johnson. But then, because we can postulate from one study that it conferred better immunity, then it's good news for the people who will get the mixed and match vaccine to know that other studies have shown that it's better, so go for it. Please do not.
This vaccine, basically the virus is new,
Yes.
and therefore the vaccine is new,
Yes.
and we do not have existing data.
Yes.
So I wanted to help our people understand how, as a country, we are dealing with data, collecting data, and maybe not yet time to analyze it for future analysis so that you can learn from it. So where are we and how prepared are we as a country to store our data?
Okay.
And where are those places where that data is being kept?
Okay. So I have to laud the country and the health professionals and the health institutions such that during these COVID vaccines, we've had to be stretched to come up with quick ideas, data collection, online data collection and research. So what is currently happening is in the institutions that have are managing COVID patients, the large institutions in the country. So they're collecting that data and with Cambry, because Cambry is the one that are typing for us the virus, then we write it up. They have a database, that's a Cambry database and the ministry database, and that's where we are getting the information and we're storing. So and when we need the data, then we are able to retrieve it. And this is, we can see this by the daily briefings, that we've gotten this number of cases. So all the COVID cases are usually transmitted to the ministry from the whole country. And that is the information that probably we're going to take up when and if we need the data to do studies. But currently a lot of studies are going on, and the beautiful field now that we're getting into is, do we have a treatment for COVID? And that's where some centers in Nairobi have actually gone into and come up with that information, that we have some drugs that can be used in severe COVID.
Right.
So we still have a long way to go as a country. Let me start saying that, okay? In terms of how much budgetary allocation are we giving to the health? You know, are we prepared for probably another wave? Are we prepared for another virus that may come years down the line? And what are we doing about it? Yeah, and so it's a place where we have been shaken, okay, out of our comfort zones.
Yeah.
And as the country, as the medical institutions, as our research centers, then we need to be prepared to get this data and put us in the world map.
Yeah.
Because the only way we get there is if we publish.
Yes.
Yes.
Fantastic. That's a very well answered question. Yeah. So we tackled two aspects of COVID. We have talked about the cases and the way we have that good information and we see it during the briefings. Then the second is the medicines for treatment. But now let's come to the vaccine itself. So with the vaccine, do we have a database now for reactions? So we know how to advise the population.
Okay. So the database is there and it's run by the Ministry of Health, that's in Kenya. But then we're seeing a very slowed response of reporting of the adverse events because that is the only way we'll know, or the ministry will know, which adverse events are in the country. And it's better reported when it happens, when and if it happens, okay? And so that is where we're going to, the way to get it for the congregants or for the common mwananchi is to either go to a center that is offering vaccinations and to report. Once they report, then they should be taken up by the center and they're able to transmit the data to the ministry. So the database is
fantastic. Is there like an online portal where we can, for example, I take the jab today, in the evening I'm feeling weak, I post that. Tomorrow morning I'm feeling like I have nausea, I post that. Is there like a portal or we are not there yet?
So there was a portal that was distributed amongst the people who got their vaccines at one of our institutions, but mainly distributed to the healthcare professionals. But to the common people, they're not yet there. But that is where we should be getting.
Yeah, so we can challenge our techies.
Yes.
So go ahead and challenge our techies.
Yes.
To figure it out, to help be part of the solution.
Yes.
Yeah.
So totally, one of the ways and the innovative ideas that should come up is how do we get this information to the grassroots? Because most of the people now have phones, you know, majority of the people. Can we come up with a program
or an app,
to report such adverse events or to report anything concerning even with the virus, you know, or concerning the vaccine or anything totally. So yes, that's a challenge to them.
That's a good one. Thank you so much. I think we have time to tackle another issue.
Yes.
We've learned a lot, right? Everybody is learning. The professionals are learning, our government is learning, everyone is learning. Churches are learning how to do business in a different way.
Yes.
So everybody in the space of learning. But when it comes to the country, learning informs us on how to do things differently. For example, if you talk about the future of medicine, as a country, we may be talking about things like education, the issues like research, and we know universities are positioned to educate people, to transfer knowledge. They're also prepared to do research and to do consultancy. So that's the hub for learning, knowledge building, knowledge transfer, and stuff like that. So, is that something you could like to say to us as a country in terms of how we get ready for the future? And I'll give you an example. I was sitting at a clinic one time in a different country, and at the reception there was a pile of magazines, and I took a publication and I began to read, and I saw the development goals for that country for 50 years. And they were saying we need so many engineers, so we need so many doctors. So the research we've been doing is leading us to decide that this future, we can only get to this future if you have these professionals ready for us. So with that background in mind, is there a way as a country we can now take stock of what we learned through COVID and begin to inform our education, our research, our publications also? Talk about that a bit.
Yes. So That's very key, Pastor Maggie, because when all is said and done, and when COVID is over, then what do we have? So education and health, I want to talk about the two. So for education, we have brilliant tertiary facilities and medical universities that offer the medical field, but also other studies. So we need to get to the ground and collect the data and analyze the data and publish that data, because then that puts us in the map of the world, okay? The other thing is what our developmental goals regarding research and medical education. So we need to get a lot of funding for research, for medical education, and for even health in the country, right? The other thing then that we say is, do we get to a point of not depending on other countries to get things like vaccinations and things like medication? Can we strengthen our Cambridge Institute to develop the vaccines? I know there are some vaccines that are in development. Can we boost that in the sense that can we be self-sustainable as a country? We have the personnel, or can we teach the personnel? Can we fund that area? Because now, as you can see, what's happening is AstraZeneca is being produced by India. Once they had their surge, they closed.
Yes, indeed.
What if Johnson & Johnson, they closed? So at some point, we have to be very self-sustainable as a country. And I believe we have the personnel and we have the expertise if only we actually put that as one of our key agendas. So depending on education and on health, then we need to consider the budgetary allocations to that. And we need to give it more thought and give it more allocation to boost us, because believe you me, like we were discussing, Spanish flu came 100 years back, went, COVID comes, we don't know how it will pan out. Probably there will be another virus that will come. Are we prepared as a country for that? I think it's time to be. And this we can only do by a lot of data, a lot of research, studying about it, writing about it, and putting in the things that are needed for that. Yes.
Especially the money. Thank you so much, because we say one of the, where your heart is, that's where your treasure is, right? That's what the Bible says. And also, if you want to know what is core, just look at the budget, where our allocations are largest. That's where we are concerned about. But I know as a country, the two big items in terms of budget allocation is education and health. So I think the tweak there is to focus on a future, not just doing the normal things we do every day, training guys to do dentistry or medicine the way we do, but know that we have another aspect of medicine that we need to be paying attention to.
Yes, and artificial intelligence actually comes into, you know, like expecting or doing genetic studies of how these viruses are mutating and what to expect, because that's actually the place of medicine now, expecting even before we get there.
I like that. Thank you so much. I think in the coming years, we'll be remembering this conversation and looking at maybe our policy plan, our development plan for education in terms of medical education, research, data collection and stuff like that. We can see that somebody will listen carefully today and say, oh, my heart is being tagged to be a contributor in that area. That would be nice.
Yes,
that would be a good day when that happens.
Definitely.
So thank you so much, Caro. I think that's what we have time for today. Our time is telling us kwaheri. So I want to say kwaheri too.
Thank you.
And thank you so much for your insightfulness that was spreaded. I hope you can come again.
Thank you.
And teach us more. Let us learn more.
Thank you for having me, Pastor Maggie. And I have to applaud you for this space that you have created for us as a church, but also as a country, to just learn for the common mwananchi, away from the medical sphere, about the common things that really bother us as people, you know, as the common congregation. So thank you for providing this space, and thank you for inviting me. I'd be happy to come again.
Oh, thank you so much. Welcome, and I welcome back many times.
Thank you.
But guys, thank you so much for your tuning in. I had a blast. I hope you too had a blast. You learned a lot, have learned a lot. And we have Dr. Caro Gulavi to thank for her time. She's actually a consultant physician, so her time is valuable, and she spent it with us, so this is so nice. We thank you so much, Caro, again.
Thank you.
Come again. But guys, see you next week, Wednesday. We'll be looking at nutrition. You don't want to miss that, because it will help you deal with adversities like HIV and AIDS, things like COVID and stuff like that. Anything we can think about. Keep your questions coming. Keep them ready. God bless you. Have a lovely afternoon.